It's hump day, and we have Dr. Wendy McDonald in studio, so you know what that means, right? The OBGYN with no filter, Dr. Wendy McDonald.
And Dr. Wendy!
Hi, everybody!
Thanks for coming back to the think tank.
Thank you for having me.
Today we're talking about urinary tract infections, UTIs.
A urinary tract infection is when bacteria makes it into the urinary system. Down in the genital area, if you will, there are 3 holes.
Three?
3. The urethra, where you urinate, where you actually pee. The vagina, we all know what that does. And the anus. That's what it looks like from front to back.
Am I living in a dream world? Is your discharge green, girl? I know you sick and tired of worrying. That's why you came to get tested.
So you're all about keeping it real and telling it like it is, right?
That's right.
We can agree on that.
That's
so
right.
You're going to tell me a little bit about things that I don't know. So if it's yay, if it's true, it's nay, if it's false. Dr. Wendy will then explain why your answer is right or wrong. Are you guys ready?
Okay, let's do it.
I can't stand the pain. It's my menstrual. When the pain hits me real low, I start to think I might have endo. Endometriosis is a diagnosis, but this is not easy to handle.
Okay, here we go. First question. Birth control causes infertility.
I'm a big nay.
I agree with both of you ladies. You're very
Okay.
wise. Birth control does not cause infertility. However, I mean, in the moment that you're taking it, it does, because that's the whole point, right? I mean, like, if it makes you more fertile, then it's a problem.
Yes.
But after you stop taking it, you should remain just as fertile as you were before or at the age that you stopped taking it.
That's why we take a shot, because it works to prevent disease, shows my defenses, the germs before they ambush me, so you and I can survive like a battalion, strong and ready for the battle between virus and human. Please go get your shot. Geniuses, raise up your voices. Tell all your people what the logical choice is. I'm with you. This miseducation should halt. We got to be carefully taught. If you're taught, you're gonna get your shot.
Do we get a mood swing pass on
No,
anything?
you get just punched most of the time.
That's how it works. So, but it is genuinely something that guys should respect. Is that it really is something? It's not
a
a
real
cop-out
thing.
excuse. This actually goes on.
It does, and I would say if you feel like your significant other is having a lot more mood swings than normal, you probably want to just ask, hey, you don't seem like yourself. Is there anything I can do? Is there anything that's going on? Just so that the person can be more aware of the fact that maybe they're not being so nice.
I'm living my best life. It's a birthday, at least that's what I'm dressed. I'm a new mom, it with terror. I'm not sure I'm ready. Me, little baby, skin to skin, first breathing steady. It's the first time you have met, fresh as necessary. Now she's rooting, let's get moving. Try the slow and steady. Let's sit up, get position, cross the chest. Or that football, hold whatever fits you best. Then you pull that baby to you, you can pick which breast. Then you make that mouth open wide before you lash.
Okay, so now let's talk about women's breasts.
Yes.
Because this is what I figured I'd be talking about at 7:47
It's
this
a great
morning.
segue.
Perfect segue. Is there such a thing for this? Is there a sensitivity or a tenderness right before women begin their menstrual cycle?
Very much so. So the glands of the breast change before the menstrual cycle comes, and that can cause a lot of sensitivity, that can cause nipple tenderness, that can cause, again, irritability. So you want to be careful in those moments. If she says, ooh, that's a little sore, you probably want to be a little bit more gentle, or maybe just leave them alone.
Leave the boobies alone.
You can leave them alone. They're probably really cute because they're a little bit more like voluptuous. Look, don't touch.
Okay.
When my period comes through, I know I made it through the storm. I really want to do a lot. Don't need no babies to be born. I am searching for some blood to confirm there's no pregnancy. Won't you come down on this liner? It's the assurance that I need. Real blood. I'm searching for some real blood. Not just a little spot. Real blood.
Not easy. These are not easy, I tell you. Because a person who has discharge can be normal. But then a person can also have a yeast infection, a bacterial infection, an STI. So it's possible that it's a problem, but it's also possible that it's completely normal.
Okay, so hold our card like
right,
this.
hold it in the middle. Like, at an
like
angle.
this. Yeah. and
Okay,
next.
here comes the last question. You only have to visit your OBGYN every 3 years. Yay? Or nay?
This is the biggest nay
I
ever.
love you guys.
Say that when your sugar's high, you won't know what that's some screening. Cholesterol is clogging, too late if you're just hurting. But if you check up with your doc, you can learn it. And don't forget the dentist, your teeth, they deserve it. Plaque causes caries, the dentist removes and stops those cavities.
mucus, which is the cervix is kind of like the passageway between the sperm and the egg. And so if you block the sperm from getting through the cervix, then you kind of are doing something similar to what a condom does as far as creating that barrier. A pill actually stops your ovary from releasing an egg. So there's no egg there. So even though the sperm can get through the cervix and into the uterus, there's no egg for it to fertilize.
Okay, so I think I need a visual to understand this IUD situation.
I can demonstrate it for you.
Ooh.
This is sperm. Wow. This is cervical mucus.
Okay.
This is your cervix and your uterus.
I see.
And you know what, Lucy? There's an egg down there that wants to be fertilized.
So this person seems to be potentially pregnant
Yeah.
if she's not on any form of birth control.
Fertility. Now, let's get rid of these sperm. Get out of there, sperm. Oh, some sperm are left behind. Imagine this is cervical mucus, and it is now blocking the passageway between the vagina and the uterus where the egg resides.
Okay.
Try it again, Lucy.
Oh. Oh wow, that's a lot of sperm and no baby.
Nice try, sperm.
Long as we got blood, oh. Long as we got, I hate my periods, don't like my periods, can't stand my periods, no it's not fun, don't take it personal. If you like to see your menses, it's just another way that